about 2,000 or so physicians in the country. Nurses make up about 35% of the entire workforce, health workforce. Significant. And if you were to look at Cameroon physicians and look at specialists only, this is what you find as of 2010. For some of us interested in general surgeons, government report says there are 62 general surgeons in the country, 2 cardiac surgeons and 9 pediatric surgeons in the country. That's government data, not mine. If you look at it, we have 11 urologists, and I actually didn't know there was a sexologist in Cameroon. I don't know. I just don't know. But that's what you have. And I've presented a lot of data. What does that really mean? What's the context? What does it mean in real terms? I had to then look at Emory and say, what does this mean? At Emory, we have the Emory Health Network, which was started in 2011, and we have more than 6 hospitals, 200 provider locations, 1,800 physicians in more than 70 specialties, and 220 primary care physicians. That's the Emory Health Network. And if we were to look at that and look at the physician density, for Cameroon, you mean 0.9 physicians for 10,000 individuals. That means Emory Health Network should be responsible for 20 million people. Think about that. That means Emory should be the only health system in 3 states, Alabama, Georgia, and Tennessee. That's the trouble. That's the problem that you face. Think about it. There's no Vanderbilt, there's no UAB, there's no Piedmont, it's Emory Health Network. So when you look at the challenge, we have to be able to contextualize it to be able to know what strategies to implement. Obviously, you have task shifting that becomes very important because you don't have the physicians there. Somebody has to do the job when the patient comes in dying. So you have to be able to, and this is used as a stopgap mechanism to be able to provide services. We see that in physician settings.